You're welcome to the Uganda Cancer Institute. My name is Dr. Nixon Niyonzima, and I head research and training at the Uganda Cancer Institute and the clinical labs at the Uganda Cancer Institute. As we celebrate 59 years of independence of Uganda as a republic, I would also like to take you through a journey of the Uganda Cancer Institute, which this year celebrated 54 years of existence. The Uganda Cancer Institute was established in 1967, initially as a cancer research site for the then newly described Burkitt's lymphoma, which was described here at the Uganda Cancer Institute. Initially, we were managing liquid tumors or lymphomas, which Burkitt's lymphoma is. But in 1969, another word was added, and we became the Uganda Cancer Institute. Over the 54 years of existence, the Uganda Cancer Institute has undergone evolution to become a comprehensive cancer center, managing all types of cancer and providing all types of cancer treatment modalities. And over the past 10 years, we have undergone a remarkable transformation from the Institute, which used to have just 3 old buildings that were left over from the old Mulago days, to a comprehensive cancer center with multiple structures, with a lot of infrastructure to manage cancer patients. And this has all been done with the support of the government of Uganda, which has enabled us to bring on board several partners that have also enabled us to reach where we are today. As a patient, when you come to the Uganda Cancer Institute, there are several pathways of coming to the Uganda Cancer Institute. One, you can come as a patient who has had a diagnosis of cancer and you've been referred to the Cancer Institute. But you can also come as a Ugandan who is seeking cancer care services. You don't have a diagnosis. The Cancer Institute will diagnose you and treat you if you have cancer, or refer you appropriately if you don't have cancer. We have a comprehensive diagnostic setup. We have laboratories, a comprehensive cancer laboratory. We do clinical tests. We also have a pathology laboratory that handles tissue samples. In addition, we also have an imaging department. Our imaging department has a CT scan, has heavy-duty ultrasound, as well as digital X-ray and mammography, which we use to diagnose patients, but also to stage our patients. So when a patient comes in, they don't have a diagnosis of cancer, we take them through all this diagnostic setup until we either make the confirmation of cancer or rule out cancer and refer them appropriately. If you come as a patient who has cancer, you're then managed from the beginning. We do staging workup and then manage you depending on the type of cancer that you have. All the services at the Uganda Cancer Institute are offered free of charge to the patients. And the goal of the Uganda Cancer Institute is that every Ugandan should have equal access to cancer care in all departments. We also have a comprehensive treatment setup. We have medical oncology, we have pediatric oncology, we have gynecological oncology. And the goal is that every Ugandan who has a cancer diagnosis or has a cancer problem can actually be managed at the Cancer Institute. In addition to these departments that I've mentioned, we have set up an extensive renovation program or remodeling program where we have built 6 radiotherapy bunkers. If you remember, in 2016, there was a breakdown of radiotherapy bunkers, and at that time the Uganda Cancer Institute, or Uganda as a country, had actually only 1 radiotherapy machine. But over the past 5 years, we've built capacity at the Cancer Institute, and we currently have 6 radiotherapy bunkers and 4 radiotherapy machines, including 3 external beam machines, which comprise 2 Cobalt-60 machines and 1 linear accelerator, as well as 1 high-dose rate brachytherapy machine. In addition, the Cancer Institute is building more infrastructure to manage patients. We're building a new 8-level inpatient building that will house 150 inpatient beds, really to expand capacity to manage cancer patients. And in addition, with support from the African Development Bank, we are also building a multi-purpose building. It's a multi-purpose infrastructure. It will have clinical care facilities, including outpatient clinics, state-of-the-art theaters, conference facilities, research laboratories, and other inpatient facilities, really to enhance the patient experience at the Uganda Cancer Institute. That facility will also have an MRI, a 3 Tesla MRI, which will be one of the cutting-edge equipments that we'll be using to manage our patients, but also to diagnose cancer in the country. And through support from the government of Uganda, we're also expanding our capacity to do diagnostics by setting up a nuclear imaging facility, and commonly many Ugandans leave the country to do what they commonly call PET scans, but we're establishing that infrastructure here just to make sure that every Ugandan can access the best cancer services in the country here at the Uganda Cancer Institute. In tandem with the National Development Plan 3, the Uganda Cancer Institute is also establishing regional cancer centers. We have planned to establish 4 regional cancer centers across different regions of the country. We're establishing a regional cancer center in Gulu, which will be the Northern Uganda Regional Cancer Center. And this will be catering to patients who would want to access cancer care services but cannot come to the Uganda Cancer Institute. We're establishing another one in Arua, which will be the West Nile Regional Cancer Center. We'll have one in Bale, the Eastern Uganda Regional Cancer Center, and we'll also have one in Mbarara, which will be the Western Uganda Regional Cancer Center. And the goal is really to increase the coverage of our services from the current about 20 to 30% to more than 80%. That 80% of the Ugandans who have cancer or need cancer care services can actually access cancer care services within their local communities.
Long live Uganda for God.